Health meeting for November 14th. We'll do the Pledge of Allegiance. I'll start us off here.
I pledge allegiance to the flag of the United States of America and to the republic which stands one nation under God, indivisible, with liberty and justice for all.
Very good. Ms. Teresa, roll call for us.
Commissioner Matthew,
Here.
Commissioner Hoffmaster,
Here.
Commissioner Houts,
Here.
Commissioner Leiniger,
Here.
Commissioner Baker, Commissioner Lanius.
Here.
Thank you.
And I received the message Rusty's not gonna be able to make it this morning, but he'll be here in spirit. So very good. Move on to C, approval of the agenda.
Commissioner, I would like to add an item of, we call it old business, approval of the health officer's evaluation. Don't believe that was actually done at, remember a motion made at the last meeting to actually approve the evaluation. So add that as old business, chapter number 7.
So before new business.
Yeah.
So we'll do, okay.
Support is available. So that'll be 7C then, right?
Well, you could recall it, rename it letter number 8 and then move the others down.
Yeah. We can do old business. Okay, we have a motion and we have support. Any discussion? All right, all in favor with an eye?
Aye.
Opposed the same? We have it. Okay, very good. Thank you for that. All right, letter D, approval of the minutes from October 3rd, 2024.
Motion approved.
Very good. We have a motion.
Support.
We have support for the discussion. All in favor with an eye? Aye. Opposed the same? Motion carries. To item number 2, public comment, very important part of our meeting. We don't have anybody knocking down the doors today, so everybody's happy in all 3 communities, which we appreciate. Public comment is open. Seeing none, we will close public comment. Moving on, health officers report, Ms. Rebecca Burns.
Good morning.
Good morning.
So we've got some business items that I mentioned here right at the beginning, medical insurance renewal today on the agenda, as well as the PA 152 annual board decision. So we'll be getting to those shortly. Talk just briefly about respiratory virus season, which we are now in the midst of, and encouraging residents to receive those vaccines that their provider recommends for them. And if they don't have a provider, they are always welcome to reach out to one of our nurses here at the health agency. Our National Labor Relations Board item, we did receive notification from our attorney that they granted our request to dismiss, so that is now closed out. Our environmental health electronic application portal is very close to launching finally. I know EH is excited about that. The clerical team received some initial training recently, and we're expecting by January of 2025 for that to go live. That will allow residents to make an online application without having to come into the office to do that. Staffing updates, we do have some position open in personal health and disease prevention. Our mobile nurse is now open again. The nurse that was in that position took the children's special health care position vacated by Madonna Hilardes, who retired. So she just recently retired. And so that position is open again. And we have some part-time positions, I think, that maybe just going to fill in the clinic.
Yeah.
So, well, the offers have been made. So we're getting close to wrapping those up. We do. Yeah. Yeah. The dental hygienist was hired as a contractual staff member. Her name is Angela Shed, and she's already working. So, yeah. AAA is still seeking a part-time outreach specialist and also a nurse at this point as well. And environmental health is very close to filling the type 2 non-community water supply coordinator position that was vacated when staff member moved into a supervisor position. So,
yep.
So there we go, kindergarten oral health assessment. Angela did start and has been meeting with superintendents, at least she did in St. Joseph County. I'm not sure if she's been to the other 2 counties yet. Has also been doing some training and is really getting ready to move that along. Heidi will be able to talk any more about that when she gets to her time. We continue to work with Beacon Health Systems in Three Rivers on their community health needs assessment, which is really wrapped up at this point. They're just doing some final reporting out. MELF, the Michigan Association for Local Public Health, is tracking some bills. Senate Bill 875, which would modify vaccination requirements for children at certain ages. There's a package of tobacco bills, and of course the statewide sewage code. And MAC produced an issue brief, which actually I found from paying attention to the Hillsdale County Commission agenda. Have not seen that. Actually, Mel had not seen that until I saw that. So thank you for sharing that publicly, because then I shared it publicly. And so there are some good parts in that bill, and there are some real concerning parts still in that bill. And MELF is continuing to have conversations with the Senator Singh, as well as our lobby. MELF has a lobbyist that they contract with, PAA, and they're continuing having conversations with the Senator about that bill and issues that are of concern to public health. So public health concerns in Michigan, pertussis in particular, we've got some additional new cases here in the district, and there are more cases of pertussis this year than there have been in recent years. This is a vaccine preventable disease, and we are watching and trying to educate and encourage people to seek care and obtain vaccination. Our Gleason Road, St. Joseph County thing, there was yet another sewer line break, this time on King Road, very close to Gleason on the 20th of October. We're going to continue to receive reports of sewer line breaks until that first main's been replaced. But I did mention last month that permit has been issued for the construction project. So hopefully that's moving along. As far as HPAI, the dairy cattle and poultry flock issues, we've continued to have dairy farms that have positive cases. There was one new one since the last time I reported, although it does seem to be much less and slowing, which is good. Rabies, we continue to have positive cases of rabies in animals in Michigan, total of 46 as of the 31st of October. And we always do this here. We just encourage people to seal up those openings, try to prevent entry of bats into your home. Most bats are not rabid, but some are. And because we don't know if they are or not, we want to just prevent them from cohabitating with us. And then human arbovirus illnesses, this would be, your mosquito and other tick and other viruses like that. 31 West Nile virus cases in Michigan this year and 4 Jamestown Canyon. We expect additional cases until peak transmission has passed. So lots of things going on there. Some maps that show you actually where we're seeing some of those identified cases. All right, so office updates in Coldwater. We have heard from Administrator Norman that the county is planning to replace the aging HVAC equipment, which is on the roof here at this building. We expect to be charged 60% of the cost, but have yet to receive any cost estimate on that. And the restrooms and the counter up in the front clinic, we are still waiting for estimates or bids to come back on those repairs, which desperately need to be done. Hillsdale office, we have a water softener in that building that failed and needs replacement. There were bids collected by Hillsdale County Maintenance Finance Committee, reviewed those. There was an additional question on one of the bids, which we firmed up. So there was one bid that was somewhat confusing. The one from Culligan looked like it might require additional contractor. Wasn't in the bid, but that has been confirmed to not be the case. So the bid is all inclusive from Culligan. All right, and nothing for Sturgis or Three Rivers. There is Board of Health Education on the schedule for today, and that's going to be about a new grant the agency received for reducing traffic issues with horse and buggy transportation. And that's what I have for you.
Awesome. Thank you for that report. Any questions for the help? Yep, we're at
The kindergarten oral health assessment. You indicate there that the agency received a license. Because we're running that through a subcontractor as the input working on that, aren't do they have a license as well?
Well, she has her registration as a dental hygienist. We're carrying the license.
And that's sufficient for that.
That, yes, we did check with our attorneys.
And then on the staffing update, you indicate the mobile nurse position is open. That seems to be a recurring situation.
It does.
How many miles did we put on the van this year?
It's a good question, and I don't know the answer to that. Without.
And I forget what we paid for that van.
Yeah, I don't remember that either, but yes, it's not anywhere getting enough use. And I would like to see it out more, a lot more. There isn't any reason why we can't schedule existing staff to utilize. So maybe we'll work harder at that while we're trying to find others.
And then maybe,
It wasn't out and about often this past few months because of the chauffeur license.
That's true. We had a little hiccup. When we originally purchased the van, we were told we didn't need any special licensing, which you don't apparently in Indiana, but apparently in Michigan you do. And so that came to light, and that kind of put the van in parking for a
who
while.
told you you had to have a license?
Our new HR staff person notified us that she thought we were wrong. So we looked into it and we found out that we were wrong. It has to do with the weight of the vehicle.
But the combined weight, that's not over 26,001 pounds. And it's not a combination, just a single weight vehicle.
We reached out to the DOT and they indicated that we need.
Okay, so you did talk to somebody at Michigan State Police, Motor Carrier Division. That would be the person that I would want to talk to.
We'll verify. But we did check. I mean, we didn't just go, oh.
Yeah.
No, we did check and we thought.
And I may have a contact we can reach out to.
So anyway, that did park it for a little while while we got some staff with chauffeurs.
But that's us. She still made all the visits.
Because
Does it have a commercial plate on it?
it does, well,
Government.
it's got a government plan.
Okay. Do you transport more than 4 people in at one time?
One or two.
Big barrel and stuff.
Well, but it
We gotta know for sure.
well, can make a decision at the time if somebody wants to take that position. Well, now I got to go and get a chauffeur's license
Right. Right.
to be able to keep that position.
Yeah. Can be restricted.
Which we thought we did. You know, I mean, we really did think that we, checked this, but we will check it again, to make sure.
We appreciate that.
Yeah.
Anything else, Commissioner Leonard?
No.
Commissioner Matthews?
Thank you, Mr. Chairman. Thank you for raising that question. During the COVID or thereafter, we purchased about $150,000 or so.
Yes, it was 150,000.
Right. I think that time I may have mentioned that we need a report like this, how we use that. I wonder, you can email me how many miles in it past 2-3 years. Please, thank you.
Sure,
Thank you.
anything else? Yep, you're welcome. Any other questions for our health officer?
What would you suppose? Took a wild shot. Why do we go through so many new nurses? That position is vacant a lot.
We had one that, she just wasn't working out. She wasn't really complying with,
Standards.
standards. Yeah. And Amanda has been great. She's a real go-getter, but she really, her heart is at home visiting, and this position opened up for Madonna, so that's why she jumped on that. So I don't think it's the position itself that they're not liking and leaving. The one prior to her, Carol, she took a job in the Detroit area.
Yeah, she moved.
She got married. So I don't think it's just the position itself.
Karen loved that
did.
job. She loved the independence of, you know, being out and about and, you know, driving around, but yeah.
I just wondered if there wasn't something within the job that's driving them away.
Well, I mean, primarily they're using it for vaccinations. I don't know if we ever did use it for anything like HIV or STI testing.
Or not.
And we've talked about using it for WIC, but I don't know if we've ever done that either. So it's primarily been used for vaccination purposes.
Outreach, it was at the Project Connect event. It was
Yeah.
a nice display and sort of an eye catcher when going into that event.
Yeah.
And when it is staffed, is it a complete full-time? Did somebody work at 40 hours? Is it a hit and miss or?
I think it depends on the season too. So it's not a complete 40 hours. That nurse was also doing other work.
Yeah.
None of our, all of our staff, I think, are based on 37.5 hours.
Yeah, they're not, yeah. 7.5 hours.
My point was more.
Is a first.
Yeah.
Which man?
Thank you, Mr. Chair. Ms. Hazel indicated that particular person who had she desired independence. Can you describe? Before that, my question is, did we attempted to work with her to keep her? Why did she leave?
She went to Detroit, right?
Carol.
No, not that.
Which nurse?
The next, I believe.
That was her,
Sorry, I was-
wasn't it for a short time?
Allegedly, she went to graduate school, that person.
I would just, so our first nurse was Carol, and she was from the Hillsdale area. She ended up getting married, and they moved to the southeast side of the state. She's the one that really just loved it. She just loved that job. And then our next nurse
Was
was,
this Brianna? She couldn't get to work on time and some other things going on. So.
and then was Amanda the next one?
Amanda.
Then Amanda was our next nurse, and she's the one that likes the home visiting type of nursing, and the CSHCS position is perfect for them because they do a lot of home visiting, talking with families, working through issues. So, yeah.
Thank you.
Okay, very good. Do you have anything to add to the conversation? I appreciate that. All right, moving on to number 4, medical director's report, Dr. Lebrel.
Good morning.
Good morning.
My report is in your packet. Kind of new things for October. I did attend a virtual vaccination meeting last Thursday. Lots of information.